Experience shows that for most children with additional needs, toilet training is achievable if approached correctly. Becoming toilet trained is like climbing a ladder. At the bottom of the ladder is the dependent nappy-wearing child who cannot meet any of their own needs. At the top of the ladder is a child who can use the toilet independently, including wiping their own bottom, flushing the toilet, and washing their hands. The aim of toilet training is to enable the child to get up as high up the ladder as they are able. Some children don't get to the top and may always need some help with some aspects of toileting. With the right approach and the opportunity to try, many children get far higher up the ladder than their families and healthcare professionals ever thought possible. Children with additional needs may not show any signs of readiness for toilet training. Toilet training for all children should not be delayed. Toilet training children with additional needs should commence between 18 months and 3 years. Toilet training will take longer than in normally developing children. Suddenly presenting a child with pants and a potty or toilet and expecting them to get the idea to sit happily and wee or poo is unrealistic. Children need to be firstly introduced to the skills they will need to help them become continent, getting ready for toilet training and skill development. All children should be proactively supported to learn these skills early in childhood. Before you start, report any problems with constipation to your child's GP. If the child requires laxatives, these should not be stopped until after toilet training is completed. If stopped too soon, it can result in withholding and only pooing in their pants or nappy. Speak to your child's occupational therapy about any mobility or sitting problems and any sensory issues. Ensure your child has a good fluid intake and a well-balanced diet. Ask your GP to refer you to a dietitian if you have any concerns about your child's growth or diet. Buy a potty or a child's toilet seat. One with handles helps a child feel more secure, and a step which helps ensure good toilet position. Children with autism may benefit from starting with sitting on the toilet to avoid any difficulties with transitioning from a potty later on. Developing toilet skills. Choose a toilet cue, for example, a toilet or potty symbol, or a call board, words, pictures, toilet schedule, or social stories. Do not ask the child if they need the toilet. Instead, use an instruction like toilet time. All nappy changes should happen in the bathroom. Remove or change the child's nappy in the standing position. And start by encouraging the child to sit on the toilet at all nappy changes. If reluctant, they can start sitting fully clothed. Do not teach boys to wee standing up until toilet training is completed and well established, as this can result in stool withholding and only pooing in their pants or nappy. Encourage the child to help pull their clothes down and up, flush the toilet and wash their hands. Gradually increase toilet sits to after all main meals and drinks. Use rewards and praise for sitting and try to gradually increase the length of sits to 2 minutes. Toys or bubbles, toilet bag, kept exclusively for toilet sits may help the child to sit for longer. We are not expecting the child to use the toilet at this stage. Any poo in the child's nappy should be emptied into the toilet so they can see. Use simple language to reinforce the association between poos and wees and the potty or toilet. An open door at home will help children to observe others using the toilet. Toileting should be consistent at home and in school so it becomes a routine and learned behaviour, and the child will know what to expect. They will also learn to associate the toilet with doing wees and poos. Once the child is cooperating when taken to the toilet, sits happily and attempts to pull their clothes up and down, it's time to put these skills into action. The next step is identifying the child's habits. Try putting a folded piece of kitchen roll in the nappy or wearing cotton pants under the nappy, starting with the first nappy change of the day and keeping a record every half an hour to give an idea of how often the child wees and how long they can stay dry for. This needs to be done by parents or carers at home for at least 3 full days. The child is ready to move on, i.e. follow a toileting plan, if they can stay dry for 1.5 hours, are not constipated and can sit on the toilet or potty for at least 1 to 2 minutes. Families need to understand that toilet training is a skill development, not a war. If parents or carers feel they are fighting a losing battle to get their child to achieve the above steps, they need to contact their local healthcare professional for appropriate advice and support.